Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. The labor process is broken down into 4 stages. The first stage of labor is from onset of labor to full dilation of the cervix. The second stage of labor is from when the cervix is completely dilated to delivery of the baby. The third stage of labor is from when the baby is born to when she delivers the placenta. And then the fourth stage of labor will be the first 2 hours after delivery. So during the first stage of labor, this is onset of labor to full dilation. And we consider the onset of labor to be once the contractions are causing the cervix to make change. So she may be having contractions for days or even weeks prior to this, but if the cervix isn't changing, those are probably Braxton Hicks or pre-labor contractions. Once the cervix starts dilating and effacing, this is our onset of labor, and this up to 6 centimeters of dilation is considered the latent phase. During the latent phase of labor, progress tends to be slower. This might be the longest part of her labor overall. And because the cervix not only needs to dilate, but it needs to efface or thin and soften, and the baby needs to be moving down in the pelvis, there's a lot of things that are happening. So we're considering for this, we start thinking about the 5 Ps: our passenger, our passageway, our power, mom's psychologic response, and mom's position. We also will start considering pain management options, pharmacologic pain management, non-pharmacologic pain management, and during the latent phase of labor, we really encourage non-pharmacologic pain management as long as we're able to do so. This is also a good time for moms to be up and moving, ambulating, using the shower, using the tub, sitting on a birthing ball, all of these things that are going to help promote progress and descent. The active phase of labor is from 6 centimeters to 10 centimeters or full dilation, where there's no cervix left. This tends to be more of a rapid time during her labor process and also a time where coping is more difficult. So this might be a time where pharmacologic pain management is more of a consideration. So she might want to use opioid like IV medications. She might want to get an epidural. And these are going to be things that we'll be considering for her. And this is also a time when we get close to 10 centimeters that we can see what was once called transition. When we're getting ready to transition between the first stage and the second stage of labor, and she's feeling a lot of pressure and maybe feeling like she has an urge to bear down. So during the active phase of labor, in addition to her coping and her pain management, we also need to be thinking about the baby. And so we're thinking about how we can assess for oxygenation. And the best way to know that our baby is well oxygenated and tolerating labor is with fetal monitoring. So depending on if our patient's high risk or low risk, she might have continuous fetal monitoring, or we might be doing intermittent fetal monitoring to determine if the baby is doing well. We're monitoring her vital signs, we're helping with coping, we're helping with comfort, we're helping with breathing, we're helping with massage, or all the different things that we need to do to help support this process for her. The second stage of labor is going to be basically our pushing stage. So this is when the cervix is fully dilated to delivery of the baby. Prior to mom's pushing, there is the possibility of having a latent phase here if we utilize passive descent. So passive descent would be if she's comfortable with her epidural and maybe she's fully dilated, but the baby is still got a high station and the provider chooses to allow the contractions to move the baby down more before she starts pushing. And so that relies on primary power from her contractions to help the baby come down. Typically, though, what we're primarily seeing is the active phase where she is pushing and using her own power in combination with her contractions to help bring the baby down and deliver the baby. This process can take a long time, especially for a first-time mom. It can take several hours. Priorities for this is still going to be fetal well-being and fetal oxygenation. So we need to be monitoring the baby. We need to be monitoring mom's vital signs. We need to be promoting comfort and coping. And so things like cool washcloths for her head or ice chips, dim lights, music, anything that kind of help promote relaxation between contractions when she's pushing, all of these things will be beneficial. During the third stage of labor, the baby is delivered and now we are trying to deliver the placenta. So during this time, mom's holding her baby probably skin to skin. And we can take a pretty hands-off approach initially towards the third stage of labor because we can wait up to 30 minutes for the placenta, as long as we're not seeing signs of bleeding. As far as active management options, we really need the uterus to contract in order for the placenta to separate from the uterine wall. So administering oxytocin is an option, uterine massage, and also maybe encouraging breastfeeding because if she latches the baby, her body is going to release its own oxytocin, which will help the uterus contract and help the placenta separate. During this time, our priorities are going to be aimed at monitoring for and preventing bleeding for the mom and also promoting bonding with her baby. During the fourth stage of labor, this is our first 2 hours after delivery. So maternal well-being is the big focus. We need to monitor her uterus and make sure that it's staying contracted to control bleeding. Uterine atony is the #1 cause of postpartum hemorrhage in the first 24 hours. So we need to be doing frequent uterine assessments to make sure the uterus is contracted. And then we're looking at her bleeding to make sure it's normal. We can also assess her bladder to make sure it's not distended because a full bladder puts pressure on the uterus, and this can cause the uterus not to contract well and can cause the mom to bleed. So monitoring all of these things very frequently will be important in these first 2 hours. And we're also doing frequent vital signs. Oftentimes, if a woman starts to bleed and she's losing volume, we may not see it right away on her pad if it's all still in her uterus, but we might see it in her vital signs because tachycardia is one of the very first things we'll see if she's losing volume. So doing frequent vital signs is also going to be important. During this time, we're also promoting bonding. So she probably has her baby skin to skin. We're helping with breastfeeding if that's how she's choosing to feed her baby. And we're facilitating this bonding time with her and her baby. They also call that the golden hour, where she can spend time with her baby and work on feeding. Priorities during this time is going to still be monitoring for and managing bleeding, if she has any, and to promote bonding with her baby. So to review, the labor process is broken down in 4 stages. The first stage is from the onset of labor to full dilation. The second stage of labor is from full dilation to delivery of the baby. The third stage of labor is from delivery of the baby to delivery of the placenta. And the fourth stage of labor is the first 2 hours after the baby's born. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.